Oh, hello. Hey guys. Mm, So I don't know if you guys are there, but I could see your chats if you guys have any questions. I know there's a couple students on here, and let's see. Looks like there's one question about Concerta, first treatment option for ADHD, and Vyvanse is reserved for the treatment-resistant cases. Does this mean that Vyvanse is more effective than Concerta? Mm, Not necessarily. Well, both of them are stimulants. It could be just that Concerta is less expensive or it's more cost effective for people. So that's why it's used. There could be more studies supporting the use of Concerta. Uh, those are some things to consider. Yeah, I don't know if you guys are able to log on to there's a chat system. Fortunately, I can't able to see your guys's videos. It's not like a Zoom like I was thinking about, but if, yeah, if I don't catch you guys, on here, then maybe I'll just send a Zoom link soon to those who reached out to me and do a Zoom instead, because that might be a little bit, easier to communicate. Then I could just post that up later. So I'll just, hang tight for a little bit and try to get that meeting here. In the meantime, I'll look out to see if you guys have any questions coming up. Yeah, yeah, you can throw in the question in there, like, and then if yeah, yeah, I think Zoom might be easier to communicate, but what about you, James? Would you prefer a Zoom or would you prefer mm, either why don't okay, I'll hang out if people have questions, otherwise I'll get the Zoom meeting, sort of created and, send that to you guys, but in the meantime, if you have questions, you can post it while I create this, Zoom meeting. But otherwise, I don't have anything in particular on the agenda. Can a functional neurolog in what ways, if any, do you involve your faith in your practice of psychiatry? So I think that's a great question. I think for the most part, the people in front of us are like people, human beings made in God's image. So we have to treat them with like love, kindness, things like that. Even, they're often in a vulnerable state. So they may be sort of not receptive to, depending on the setting, they may not be receptive to some of that help. They may not be sort of loving or kind in return. But at the so you do have to sort of learn like principles that the faith sort of teaches, like self-control, patience, having good thoughts, praying for others. So that can't is important to do, especially as a physician when dealing with patients. And also, there's a lot of support that shows that religious services like Christianity, other faiths, going to those community groups can help with mental health. So I wouldn't say they're mutually exclusive at all. I would say if anything, um, the faith supports the other. In fact, one thing that I came across was like psychiatry, it can be very helpful, but at the same time, it's limited. Like it doesn't have an all-encompassing understanding of like human nature and what human conditions go to. For the most part, psychiatry is still a pretty recent field, just within the last few hundred years, basically. But something like faith, like the Christian faith, has been going on for thousands of years, and that has really tested or gone over the test of time much more than psychiatric medicine has. So that's a very good question. Another one is, can a functional neurologist diagnose ADHD? So, in the States, we do have neurologists. They deal more with the brain and neurological disorders, but they can diagnose ADHD. Sometimes they use like a computer test to help support, but for the most part, psychiatrists will be the ones who diagnose ADHD. It could also be psychologists. And it's in an adult, it's mostly just history taking, and, yes, a neurologist can diagnose that. It's a little bit more tedious to diagnose in children because usually you need to get it diagnosed in, multiple settings, such as home and school, or and so you have to get an evaluation by from the parents and the teachers and basically from multiple people, but when it can present as adults or sometimes children grow up and didn't get it diagnosed, then it manifests in adulthood, and so they get checked out as an adult. So there are different ways to diagnose the ADHD uh, disease. Um, okay. Any other questions you guys have? Feel free to throw them out there. Um, Otherwise, I do have this Zoom link uh, for Lee. Have you encountered or heard of depression or anxiety that was not caused by that patient's life circumstances? Mm, that's a good question. So, usually there's some parts that I mean, I can't think of like a specific case in mind, but if you have a family history of mental disorder like anxiety, depression, it's more likely going to happen in the other family members. Some people are able to manage it without treatment, some need treatment. So I would say it's possible to, like, it doesn't have to be life circumstances, but definitely life circumstances can make things more stressful and make it more challenging for people to cope with it. But usually when they come to me, regardless of what is causing it, what it's going through, it's impacting their life. And so when it comes to me, I have to treat it the best of my ability, which is usually with medications or a combination of medications and talk therapy. What percentage of patients do you do psychotherapy with in addition to prescribing medications? So in my practice, I usually have like 20-minute visits. And so a little bit of that, I'll do psychotherapy. It's not as in-depth as like a therapist session with like a psychologist who will typically have weekly sessions, maybe for 45 minutes or so, maybe 50 minutes. Just as a psychiatrist, so many people come to me with wanting medications or medication refills or adjustments that really that's most of my focus. So I can't really dedicate that much time to do 45-minute visits weekly or every 2 weeks with people. So I do abbreviated form of therapy in the visits, but ultimately they have to go to other places to get more in-depth therapy. That doesn't say that that's the case with all psychiatrists, but also if you're looking at the way insurance is reimbursed, then it's maybe not that practical to do therapy, at least cost wise. You're not going to get really reimbursed for it that well. Um, if you have like a whole more higher clientele that has more money willing to pay out of pocket, maybe you could charge them, or you could do that out of pocket. But then there's also these challenges. Well, what if you carve out 45 minutes of your schedule and someone doesn't show up to the appointment? And so you're kind of sitting there with all that time. So those are some minor challenges that do come up. But for the most part, definitely do medications. And then I try to do therapy if people need it or want it. Not everyone does. But so let's see. Any other questions? Okay, if let's see if that's all. Why don't you can I have a couple of your guys' emails. I'll send you this Zoom link, and then if anyone else is watching and wants to go on the Zoom, you can just send your email and I'll send it to you. So, all right.